Hi guys, welcome to the Train Your Brain series. This is an exclusive series for you to boost your ranks in the exam, and importantly, it's going to be a very useful tool for you to recollect the important features which are very commonly given in the stem of the questions. So जो आपके stem में दिए होते हैं questions के अंदर facts, there are certain buzzwords or keywords that you can easily identify in the question, and that would be giving you a very major hint regarding what is the likely diagnosis for a particular condition which they are asking you in the exam. This series is going to be in multiple parts. Let's get started with the first part of this series. I hope you enjoy it as much as I did making it for you, right? The first one is a clinical presentation which will make a mention of the fact the patient is going to be having the presence of situs inversus, chronic ear infections, presence of sinusitis, presence of bronchiectasis and infertility. Now, combination of these features would surely be reminding you of an example of a condition which is going to be given the name of Carter-Jenner syndrome or primary ciliary dyskinesia. Let us just recall that in this kind of a condition, there is a specific defect that is going to be seen in the dinine arm of the cilia. And because of the problem in the dinine arm of the cilia, the patients are going to be having the development of these manifestations. Please also recall the fact that such patients are going to be having the development of typically reduced fertility. And as and when we are going to be talking about the Carter-Jenner syndrome, we are going to be talking about the classical triad that we see in these patients, which is going to be associated with the findings like the presence of sinusitis, the patients are going to be having bronchiectasis, and the patients are going to be having the development of situs inversus. Instead of writing the term situs inversus, sometimes in the exam question, he will say the patient is going to be having a right-sided heart or he is going to be having the presence of dextrocardia. Talk about the next one. Combination of clinical presentation of a patient making a mention of the word arachnodactyly. There is presence of aortic dissection, there is presence of lens dislocation, and typically this is a separate ophthalmology question also. The lens dislocation is present in the temporal and upward area, and the patient is having the presence of hyperflexible joints. Immediately what will come to your mind is that we are talking about a patient who is going to be suffering from a condition that is Marfan syndrome. Now if I talk about Marfan syndrome, the patient is going to be having typically a defect at the level of the fibrillin gene. And these patients are therefore going to be having the manifestations that we just discussed. I hope आप में से ज़्यादातर लोग मेरे को बता सकते हैं कौन सा ऐसा multiple endocrine neoplasia disorder है, which is an example of a multiple endocrine neoplasia disorder, which is going to be having the presence of a patient having findings similar to Marfan syndrome. That means the patient is having Marfanoid habitus. I'm sure what is coming to your mind is we talked about the 3 M's, and when I talk about the 3 M's, of course I'm talking about a condition that is given the name of MEN3 syndrome, right? The next one is a clinical presentation where the patient is going to be having the presence of arachnodactyly, so similar feature. The patient is also having the presence of lens dislocation, but please see over here, the patient is having the presence of a lens dislocation which is downward and nasal in nature. Along with that, patient ki complaint kya hai? The patient is having the presence of pectus dysvomiting, and the patient could be having this condition. This can be a biochemistry individual question in your exam. Cystathionine synthase defect. So I'm talking about a patient who's going to be having the development of a condition that is going to be given the name of homocystinuria. अभी homocystinuria का cardiovascular medicine से क्या link है आपको पता है वो homocystinuria patients are going to be having a higher than normal risk or development of atherosclerosis. This is attributed to the fact that increased levels of homocysteine are going to be contributing to endothelial cell injury, and that is where the patients are going to be having a higher risk or development of atherosclerosis. The next, what should be striking your mind when you look at a patient who is having a unilateral cafe au lait spots, polyostotic fibrous dysplasia, the patient having the presence of precocious puberty, and the patient having the abnormality affecting multiple endocrine glands in the body. So this is classically going to be seen in a patient who is going to be suffering from a condition that is given the name of McCune-Albright syndrome. I repeat, McCune-Albright syndrome, the keyword over here would be the patient is having the presence of a polyostotic fibrous dysplasia. There is a presence of unilateral cafe au lait spots. Can you just recall for me, friends, what is the other important example of a condition where your patient is going to be having the presence of cafe au lait spots and he is also having the presence of least nodules? Of course, what you're talking about and thinking over here is correct. We are thinking in terms of a patient having a condition that is given the name of neurofibromatosis, right? Talking about the next one. Clinical presentation where the question makes a mention of a patient who is going to be having the presence of meconium ileus in a neonate, or the patient is having the presence of recurrent pulmonary infections, or the patient is a child who is having the presence of nasal polyps, or the patient is having features suggestive of pancreatic insufficiency. There can be a situation where the question makes a mention of malabsorption or vitamin deficiencies, or the patient is going to be having the presence of reduced fertility. Of course, what would come to your mind in case of a child having meconium ileus, recurrent infections, nasal polyp, pancreatic insufficiency? Reduced fertility and malabsorption. Yes, you're thinking absolutely right, friends. We are thinking in terms of a condition that is given the name of cystic fibrosis. Now, what you never need to forget is cystic fibrosis is a problem of CFTR gene, and that means the patient is having a presence of a problem at the level of chloride channel defect. May I just help you recall the fact the patients over here are going to be having a trouble at the level of what is going to be given the name of delta 508 phenylalanine problem. Recall from our discussions earlier that when we are talking about a problem at the level of delta 506, this is something that you see in case of patient who is having factor 5 mutation or Leidens mutation. Factor 508 problem is cystic fibrosis, which is going to be associated with chloride channel defect. What is the other name that is given to this baby? This baby is going to be having the presence of salty taste on taking a kiss of the baby, and that is where you're going to be having a name as the salty baby syndrome. What do we do for making a diagnosis of this condition? Of course, one important way of making a diagnosis of this condition can be pilocarpine iontophoresis, where you're going to be testing the levels of sodium and chloride in the sweat secretion of this baby. The next one makes a combination of a patient who's going to be typically a male child. Any question making a mention of a male child, you are thinking in terms of typically an X-linked recessive condition, having the presence of calf pseudohypertrophy, and the patient exhibiting the presence of a Gover sign. May I remind you of the fact what is Gover sign? Gover sign का मतलब होता है the patient is unable to stand himself from a squatting position. So the patient is going to be having the weakness of the limbs, because of which he is going to be using the upper limb or arms to stand up from the squatting position. So male child having calf pseudohypertrophy and having the presence of Gover sign is going to be suggestive of what is given the name of the Duchene's muscular dystrophy. In case of patients who are going to be having Duchene's muscular dystrophy, what exactly is the protein that is going to be defective? Yes, you are very right. These patients are going to be having a problem at the level of dystrophin. So there is a problem at the level of dystrophin, and this dystrophin is going to be relatively less or deficient in the patients. Whenever I'm going to be talking about a patient who's going to be having the presence of a mention of the fact the patient is going to be having the presence of a slow progressive muscle weakness, again in a boy, but the question therefore is going to be associated with X-linked inheritance, and there is a presence of a deletion in dystrophin. Typically, if it is a higher up question, it will make a mention of a non-frame shift mutation or responsible for deletion in the dystrophin. We are not thinking in terms of Duchene's, we are thinking in terms of a condition that is given the name of Becker's muscular dystrophy. So Becker's muscular dystrophy is an example of a condition where the patient is going to be having the presence of a non-frame shift deletion at the level of dystrophin, and therefore we say BMD, Becker's muscular dystrophy. Badly made dystrophin is what is seen in these patients. So deficiency was seen as Duchene's, but badly made dystrophin is seen in a patient having Becker's muscular dystrophy. The next one we talk about is again going to be a pediatric presentation of a patient having the presence of a cleft lip and palate. Patient is going to be having a small size head, that means microcephaly. There can be a presence of a skull defect given the name of holoprosencephaly, and there is a presence of polydactyly and cutis aplasia. So child having the presence of infant having the presence of C for cleft lip and palate, presence of polydactyly, presence of a small size head. Yes, we are thinking in terms of a condition that is given the name of Patau syndrome. Now, what has been separately asked you is a question, guys. Patau syndrome is going to be an example of a condition which is going to be associated with which trisomy? This is trisomy 13. Of course, there are other trisomies that you would also like to recall, and this is how we will talk about them. So the clinical presentation of a patient can be infant with microcephaly, presence of rock bottom feet, presence of clenched hands, and there is a presence of structural cardiac defects. Any question making a mention of these findings is always suggestive of a patient who is going to be having the development of Edwards syndrome. Edwards syndrome is going to be an example of a condition where the patient is going to be having the presence of trisomy 18. So we know the fact E for Edward, E for 18, that's the age that you need to remember so far as Edward is concerned. When we are talking about Patau's was trisomy 13, P for pubertal age, that is how we talk about it. And of course, not to miss out the presentation of a child who is going to be having the presence of a single palmar crease, flat facial appearance, presence of prominent epicanthal folds, presence of congenital heart disease and intellectual disability, because of which the patient is going to be having a presence of mental retardation. Yes, you are right, friends. We are thinking in terms of a condition that is given the name of Down syndrome. Down syndrome would be a patient who is going to be suffering from something like trisomy 21. So trisomy 13 was Patau's, trisomy 18 was Edwards, trisomy 21 is Down syndrome. That is what you need to remember. What's the other thing that they ask you regarding Down syndrome? Patients having Down syndrome are always at high risk for development of two important types of leukemias, ALL and AML. Which specific type of AML is going to be seen more commonly in these patients? Yes, you are right. These patients are going to be having a high risk for development of acute megakaryocytic leukemia, that means AML M7. Please also recall the fact that this particular subtype of leukemia, AML M7, is associated with a high degree or high chances of development of bone marrow fibrosis. Talking about the next one, in which the patient is going to be a child having a clinical presentation which makes a mention of a small size head, and the question makes a mention of a high pitched cry. The examiners can be very lenient towards you. आपके दोस्त हो सकते हैं, क्वेश्चन आसान बना सकते हैं अगर आपको बोल दें वो कि the high pitched cry resembles the cry of a cat, and that would be a big enough hint for most of you. That brings a smile in your face, because this combination with intellectual disability will immediately force you to think in terms of a condition that is cry-do-chat syndrome. Cry-do-chat syndrome is an example of a condition which literally means cry of a cat, which exactly is going to be the presentation of the patient. Now, why does it occur? That's a separate question. The patients are having a congenital deletion affecting the 5p arm. That means the short arm of chromosome number 5. So that is the fundamental problem in these patients. That is what you need to remember, associated with cry-do-chat syndrome. Talk about the next one, in which the presentation of the patient is going to be the presence of global confusion, ophthalmoplegia or nystagmus, and the patient is going to be having ataxia. Of course, that is what is going to be associated with the patient who is going to be suffering from a condition that is given the name of Wernicke's encephalopathy. Wait. Are we talking about something else also similar to Wernicke's encephalopathy, which is very commonly confused in the exam? And the answer is very yes. If I'm talking about the presentation of a patient who's going to be having the presence of same global confusion, ophthalmoplegia and nystagmus, and presence of ataxia, but the question also makes a mention of the patient having the presence of personality changes, or he's having the presence of confabulations or memory loss. That means the patient is going to be suffering from something else and not the Wernicke's encephalopathy. This is a patient who's going to be having a syndrome. Typically, the syndrome is what you call or associate with the name of a patient who's going to be suffering from Korsakoff syndrome. So do not jump to the answer of a question when you are not too sure, or if you are not have read all the important features which have been given in the question in the exam. The next one makes a mention of a patient who's going to be having the presence of a typical finding, that is dilated cardiomyopathy, or the question will make a mention of a high output cardiac failure. Along with that, the clinical manifestation of heart failure like development of swelling or edema, and the patient is typically giving a history of alcohol intake, or there is a history of malnutrition, because of which the patient is going to be suffering from something like the vitamin B1 or thiamine deficiency. Such would be an example of a condition in which the patients are going to be suffering from what is given the name of wet beriberi. So wet beriberi is going to be associated with the word wet because there is cardiac involvement, and of course the patients are going to be having thiamine or vitamin B1 deficiency. Again, the keywords would be chronic alcoholic intake, or the patient is going to be having the presence of nutritional deficiency. The next one will make a mention of a patient which is a very classical and easy one for you guys. Dermatitis, dementia, diarrhea, and the patients can be having death as well. So depending upon how many Ds are given, this can be given an example of 3D problem, or this can be given an example of a 4D problem, and that would be associated with a patient who's going to be suffering from a condition called as pellagra. What's the deficiency that is expected in these patients? The patients, yes, are going to be having a deficiency of niacin. That means the patients are going to be having vitamin B3 deficiency. Now, may I just remind you the fact that this is an example of a condition which can also be associated with the problem of a patient suffering from something like the relationship between tryptophan and serotonin. So yes, we are talking about an example of a condition that is going to be given the name of a syndrome, which a lot of you are already familiar with, carcinoid syndrome. And patients who are going to be having carcinoid tumor or carcinoid syndrome are at high risk for development of pellagra, because these patients are going to be having a development of niacin deficiency. Why? Because simply the niacin in these patients is not going to be produced because there is going to be an overproduction of serotonin, and that is what is going to be associated with a high chances of development of a deficiency of vitamin B3. The next one will make a mention of a patient having a classical feature. I mean, this is a glimpsing thing. Patient having the presence of hair loss, alopecia, he's having enteritis, because of which he could be having pain and diarrhea. He's having dermatitis, but the important word over here is burning feet syndrome. This question immediately alerts you to the fact the patient is going to be suffering from pantothenic acid deficiency. Now, the only thing that the examiner can play around is, instead of writing the word pantothenic deficiency, he would be making a mention of vitamin numerically B5 deficiency. So, burning feet syndrome is going to be an example of, remember the fact, burning feet syndrome is a B problem, but that's typically going to be B5 deficiency. That is what we just need to remember over here. So penta word, penta means 5. I mean, that is something which can readily help you. आपको एग्जाम में याद रहेगा, P से 5 विटामिन B5 की डेफिशिएंसी को एसोसिएट करते हैं बर्निंग फीट सिंड्रोम के साथ में. नेक्स्ट वाला देखते हैं. यहाँ पे क्लिनिकल प्रेजेंटेशन ऑफ अ पेशेंट इज प्रेजेंस ऑफ मेगालोब्लास्टिक एनीमिया. देयर इज सब एक्यूट कंबाइंड डीजेनरेशन ऑफ द स्पाइनल कॉर्ड. I mean, this is a separate question asked in the exam. Patient is having the presence of paresthesia, the presence of the numbness or the tingling sensation, and the patient is said to be having the presence of cognitive changes. Of course, without a doubt, the patient is suffering from a condition that is going to be given the name of cobalamin or vitamin B12 deficiency. Now, what do they ask you about cobalamin? Vitamin B12 is an example of a important vitamin which is going to be having cobalt in its structure. So that explains the meaning of the word over here, cobalamin. It's an example of a vitamin which is going to be containing cobalt. The next one would make a mention of a patient having the presence of swollen gums. There is increased chances of bleeding, including petechiae, presence of poor wound healing, presence of this keyword, corkscrew hair, and sometimes the question will make a mention of perifollicular hemorrhages. One of the buzzwords that you definitely need to remember over here is patient is going to be having a presence of tea and toast diet, and that would be importantly giving you a diagnosis of a patient suffering from scurvy. Now, why do we talk about it? Because scurvy is what is also being given the second important name of sailor's disease. This is an example of a condition which is going to be seen because of vitamin C deficiency. Because of vitamin C deficiency, the body is not able to have hydroxylation of proline and lysine, and because of the inability to hydroxylate proline and lysine, there is going to be a trouble in the formation of collagen. Now, because you're not having collagen, so that would explain the development of poor wound healing. That would also explain the higher risk of development of the perifollicular hemorrhages, which is going to be seen in this patient, right? अगला वाला देखते हैं जहाँ पे आपका क्वेश्चन के अंदर आता है, जब patient is going to be having a presence of bowlegs in children. Of course, bowlegs in children will immediately alert you along with muscle weakness and bone pain. Something which is going to be required over here is a trouble at the level of calcium. And any problem at the level of calcium means we are talking about a patient who's going to be suffering from vitamin D deficiency. Now, typically, if the question is making a mention of the word bowlegs in case of children and the question is making a mention of bone pain and muscle weakness, we are thinking in terms of children, the condition is known as rickets. The adult version of rickets, and I'm sure you might have read it in orthopedics as well, is not osteoporosis, it is osteomalacia. So, osteomalacia is the synonymous term, or it is going to be the contemporary term, which we've seen in case of adults. That is almost similar to what you find as in case of findings in case of children in terms of rickets, right? Talking about the next one, which is talking about the presence of a patient who's going to be having the presence of a hemorrhagic disease of Newman, that itself is going to be associated with a vitamin deficiency, and that is also associated with development of an increase in the APTT value and a normal bleeding time, which means that I'm talking about which vitamin is going to be required for the purpose of coagulation. When I say coagulation, that automatically means that I'm dealing with a patient who's going to be suffering from vitamin K deficiency. Just a gentle reminder of the vitamin K dependent factors. If I'm talking about clotting factors which are going to be vitamin K dependent, they are of course going to be factors 2, 7, 9 and 10. If I'm talking about the anti-clotting proteins which are going to be vitamin K dependent, I would be thinking in terms of protein C and protein S, right? So that is what we need to remember over here. Whenever I'm going to be talking about next one, it can be talking about a patient who's going to be having a presentation of intellectual disability. The patient is having the presence of a musty body odor. That's a big time hint in the exam question. Patient is having hypopigmented skin and he is having the development of eczema. Yes, I'm thinking in terms of a patient suffering from a condition called as phenylketonuria. Now, from the biochemistry perspective, what they can ask you over here is, what's the problem that is going to be seen in this patient? The patient is going to be having a trouble at the level of what is going to be given the name of BH4, that is tetrahydrobiopterin deficiency. This is something which most of the people tend to forget in the exam, which I'm sure most of you are going to be remembering after watching this particular video, right? Talking about the next one, which makes a mention of the fact the patient is having the presence of a bluish black discoloration of the connective tissue, ear and cartilage and sclera. In fact, friends, this is what is going to be given a separate name and a separate question asked in the exam, ochronosis. Patients are going to be having the development of severe arthralgia, and the classical feature, the urine of the patient turns black on exposure to air because of oxidation. So we are dealing with a patient suffering from a condition, L-captonuria. What's the problem in L-captonuria patients? Yes, the patients are going to be having a deficiency of the enzyme homogentisic acid oxidase. What was the discoloration of the sclera, the cartilage and the teeth that I told you? Ochronosis is the keyword that is to be remembered over here. The next one makes a mention of an infant who is going to be having the presence of a hypoglycemia. The child is having the presence of enlarged liver and the child is also having cardiomyopathy. Now, what you need to remember over here is the child could be suffering from two types of conditions. Either we are thinking in terms of a relatively milder condition which is going to be given the name of Cory's disease because of debranching enzyme deficiency, or what we are thinking over here is going to be an example of a condition that is called as von Guericke's disease. So, von Guericke's disease is going to be associated with glucose 6-phosphatase deficiency. I hope you remember the trick over here. Von Guericke's is a glucose 6-phosphatase deficiency, whereas Cory's disease, remember ABCD rule. So, Cory's disease is going to be associated with the debranching enzyme deficiency. The next one that we talk about is a child who is going to be having the presence of chronic exercise intolerance with myalgia. There is going to be presence of fatigue, there is presence of painful cramps, and there is presence of myoglobinuria. That means there is going to be a damage to the muscles. Anytime we are thinking in terms of this kind of a manifestation, yes, we are thinking in terms of a condition, muscle problem. M for muscle problem, we are dealing with myocardial disease. Since we already made a mention of myalgia and the patient having myoglobinuria, of course we are dealing with skeletal muscle issue. And what's the enzyme problem in this patient? Glycogen phosphorylase deficiency. So McArdle's is a muscle problem. That is what we just need to keep in mind over here. The next one I can help you over here is a child who's going to be having the presence of a hepatosplenomegaly. There is presence of pancytopenia. There is osteoporosis. There is avascular necrosis of femoral head, and there is a presence of a bone crisis. So not only are you dealing with an orthopedic presentation, but you're also having a hemat presentation, pancytopenia, as well as hepatosplenomegaly. And of course, what we are thinking over here is the patient is going to be having the development of Gaucher's disease. Now that has been asked in your exam as an image-based question also, if you remember about the Gaucher's cell. And we are talking about an enzyme deficiency over here, that is glucocerebrosidase deficiency. आपने मेरे को remind कराना है, which is an example of a blood cancer, which is going to be showing you the bone marrow having the presence of pseudo-Gaucher cells. बिल्कुल ठीक. I hope you remember pseudo-Gaucher cells in case of blood cancer is going to be seen as a finding of a patient suffering from CML, right? Talking about the next one, the child is having a presentation of a cherry red spot on the macula, which can be seen in so many conditions. But the question makes a mention of ganglioside accumulation and there is no hepatosplenomegaly. So when I'm thinking in terms of cherry red spot, I'm talking about and thinking in terms of a lot of differential diagnosis. But if the question makes a mention of ganglioside accumulation and there is no hepatosplenomegaly, my answer becomes very easy. This is Tay-Sachs disease. Why do I say it is Tay-Sachs disease? Because there is no hepatosplenomegaly and there is a ganglioside accumulation. What would have changed the answer? Just see the next one. Cherry red spot on the macula. The patient is having hepatosplenomegaly and the patient is having the presence of sphingomyelin accumulation. So if I say cherry red spot and if I change what is accumulating in the patients and I'm talking about hepatosplenomegaly, yes, I would be thinking in terms of a different condition. I am thinking in terms of something that is going to be given the name of Niemann-Pick's disease. So just read the question exam very carefully, friends. It happens with all of us. Sometimes in the hurry, sometimes we are so happy to see the question that we have read earlier, but we should not be making a mistake in the exam on this particular account. See the next one. Clinical presentation of a male child, again giving you a hint that it's an X-linked recessive condition, having recurrent infections, there is no mature B cells and there is a BTK gene defect. Now this is all B thing that we talked about, immunodeficiency disorder, B for boys, B for bacterial infections, B for B cells are affected, B for BTK gene defect. There brings a smile on your face and you tell me the answer. This is Bruton's disease, which is having an important finding, A-gamma globulinemia. So of course it is also given the name of X-linked A-gamma globulinemia, which was an example of a cellular change which was affected in a patient having Bruton's disease. Yes, we know the fact these patients are going to be having a defect at the level of opsonization. That is what we just need to remember so far as Bruton's disease is concerned. Talking about the next one. The history makes a mention of a patient who is going to be having the presence of anaphylaxis after blood transfusion. The patient is having atopy, there is airway and GI infections and there is autoimmune disorders. All is coming to your rescue for the exam question and therefore we are thinking in terms of a condition that is going to be given the name of IgA deficiency. Why do we talk about IgA deficiency? For the simple reason, it's the number one immunoglobulin deficiency which has been reported in humans and in most of the individuals it is going to be asymptomatic. However, this important finding of high chances of atopy, high chances of infections, high chance of autoimmune disorders and never ever to forget the important history of development of anaphylaxis after blood transfusion is a key head in the exam that it is IgA deficiency. Talking about the next one where the question is making a mention of recurrent cold abscess, there is eczema, there is presence of increased IgE, E for eczema, E for IgE, increased eosinophils and there is going to be a STAT3 mutation that can be a potential NEET PG question. Yes, we are thinking in terms of a patient who is going to be suffering from hyper IgE syndrome, which is also known by the second important name of Job syndrome. The next one makes a mention of a question which is talking about a patient who is going to be having late separation of the umbilical cord. Late separation means more than 30 days have been taken for the separation of the umbilical cord. There is no pus, but the patient still is going to be having episodes of recurrent skin and mucosal bacterial infections. So recurrent bacterial infections, presence of separation of the umbilical cord taking more than 30 days and no pus obviously is a hint that we are dealing with a patient suffering from LAD1. Leukocyte adhesion deficiency disorder 1. Of course, you recall the fact that in these patients, what's a fundamental problem? The fundamental problem that we have in these patients is that this is a condition characterized by integrin defect. Now, they can be not using the word integrin. They can be alternatively using the word like CD molecules 11 and 18. So that is what you just need to keep in mind over here. Now, what was the other important example of a LAD? Recurrent skin and bacterial mucosal infections. There is a presence of an important finding. The patients are going to be having short stature. They are going to be having a very rare blood group which is called as Bombay blood group. And of course, what I'm thinking in terms of over here is a condition that is going to be given the name of LAD second. What is the problem in a patient having LAD second? The patients having LAD second are going to be having selectin deficiency or selectins not working properly because there is a fundamental problem of Silai-Lewis X. Silai-Lewis X going to be having a problem because of a trouble at the level of fucosyl transferase. So Silai-Lewis X issue is going to be associated with dysfunctional selectins, and that is what is going to be contributing to the LAD second. Then we make a mention of a patient having a history of recurrent infections, plus there is infections with specifically catalase positive organisms. And the patient is also having presence of lots and lots of granuloma. So granulomatous infections along with catalase positive organisms typically causing infections again and again. I'm thinking in terms of a condition that is going to be given the name of chronic granulomatous disease. What's the enzyme problem in these patients? Yes, you know guys, this is a problem of a patient who's going to be suffering from a condition. The patient is going to be having a trouble at the level of NADPH oxidase defect. NADPH oxidase defect. Where exactly did we talk about NADPH oxidase? We talked about it in the formation of the free radicals, and normally we are talking about neutrophils and macrophages. You are going to be having the formation of hypochlorous radical, which is going to kill the organism. In case of NADPH oxidase defect, the HOCl or the hypochlorous radical is not produced, and that is what is going to contribute to high risk of development of infections in the patients. This is what we just needed to have an idea so far as the first part of this video, Train Your Brain, is concerned, guys. Do watch out for the other parts in the app, in the Cerebellum app, under the section of pathology special videos, and I'm sure you're going to be having a wonderful enhancement of your result, simply because this will help you enjoy and remember the buzzwords which will help you crack the questions in the exam far more easily than you have ever thought. As always, thank you so much for watching this video. Let's catch up in the next one.